Hi, my name is Dr. Chris Steidinger, and this is a 5-minute workout, part of a series of workouts I give my patients to do in the morning for 5 minutes before they hop in the shower. This instruction is going to be a little bit different with this workout. This is a shoulder mobilization workout, so it's not going to be straight minute formats. I'm going to be looking at the timer, and we're going to transition from area to area, but the goal of this is to open up your hips, open up your shoulders, strengthen your shoulders. This is a great exercise for people with shoulder issues, assuming they don't have a tear. But assuming you don't have a tear, this is a great exercise to do, very routine to do every day or every other day if you have a shoulder issue. So we're not going to do a standard warm-up. My standard warm-up with this, we're going to do a modified squat warm-up. The purpose of this warm-up is to just loosen up your hip flexors. Your hip flexors, believe it or not, have a lot to do with shoulder issues. So we're going to warm up with a modified squat. We want to throw our knees out, and we want to make sure our knees track over our feet. So we want our feet angled out at around 35-40 degrees. So this is a modified squat warm-up, and you just want to go lower and lower each time. Make sure you're throwing your back, so eventually you want to go down pretty low. You know, if you have knee problems, just take it easy, go as far as you comfortably can. But eventually you want to be able to get down to there. Okay, all right, I feel pretty loose. All right, let's start the routine. First, we're going to start off with just some basic shoulder rolls. We're going to roll our shoulders in and then back. This is kind of what they look like. So I'm going to do a few backwards. Do that for about 15 seconds. Now we're going to roll forwards. Same thing, pulling back, pulling around. Now, if you have a particular shoulder issues, that certain motions might be painful, just modify it to what you can do. Go as close as you can without you being in pain. But we're going to try to take our shoulder through a full range of motion. Okay, so I'm going to start with some shoulder rolls forward. Slowly getting bigger and bigger. Now again, we want to try to get our hands behind our body too. We don't want to just be in front of the body here. We want to make sure we're getting our hands behind our body. Do this for about another 8 seconds. Okay, now we're going to start going backwards. We're going to start with smaller, slowly expand out. And around at that speed. Now let's say your shoulder hurt when you were there, but it doesn't hurt here. Stay down here. Okay, now your shoulder should be burning pretty good. Another 5 seconds of this. Okay, now we're going to do scarecrows. Scarecrows, this is the scarecrow motion. So we're just going to do this. Now say it hurts there, just stop right before it. And sort of to go right up to where it hurts, and eventually you want to try to increase the range of motion. So this is scarecrows. Okay, we're going to switch in a couple seconds. Okay, now I'm going to do internal, external. So this is the motion. Again, if it hurts, just modify the motion. See, I'm going through a full internal, external rotation. Okay, should be starting to feel it now. Okay, now we're going to switch to using our posterior shoulder muscles. I'm just going to be doing this. Okay, now we're going to go back to a scarecrow in this position. Hey Betty, how you doing? It's okay. You shouldn't be filming during patient hours anyway, but I wanted to make sure I had this exercise for her. Okay, now we're going to stand up. Now we're going to go this full range of motion. A lot of people will have a problem with this. This is called abduction. So let's just say you can only get to there. That's as far as you go. You just go as far as you comfortably can. But the full range of motion you can get to, the better. Now if you have frozen shoulders or are real difficult doing this exercise, you can practice walking up the wall like this, just trying to get that range of motion in there. Okay. Now we're going to switch to a front raise. Flex back like that. Front raise. raise, flex back like that. Again, we're doing all these exercises for about 15 to 30 seconds each. Your shoulders should be feeling it pretty good right now, mine are. The purpose of this is just to really, really take our shoulders through a full range of motion, kind of challenge them a little bit. Really, really work the rotating cuff muscles. Rotator cuff muscles are really interesting muscles. Too little tension or too much tension and they don't work. So you want to kind of body weight, body resistance is a great way to work them. Okay, I'm going to go back to internal, external. Really, really work it. Try to get as much internal, external rotation as you possibly can. Okay, shoulders should be feeling pretty good. Okay, last 20 seconds, we're going to do rolls. Really try to get them bigger and bigger. Really try to get focused on getting your hands behind your body. Okay, there you go. It's a 5-minute shoulder mobility exercise. A little bit different structure. Shoulders feel great. Great for rehabbing shoulders, great for my patients with shoulder problems. As long as you don't have a tear, that's a great routine to do. It's going to build up all your rotator cuff muscles. It's going to increase your range of motion. And it's also wonderful for people with frozen shoulder syndrome. All right, thanks. Hop in the shower. Have a great day.